The People's Progressive Party Civic leveled accusation against the Minister of Public Health for her role in emergency drug procurement in the sum of $602 million.
Qualified contractor that supplies to the health system. They were pre-qualified. They had to meet a number of criteria, just like others that were pre-qualified. Now, so when you need drugs, you know who has what, who has the capacity, who manufactures what, and then you invite them to send in their proposal with their prices, and then you determine what you're buying from who and at what price. Without pre-qualification, the APNU AFC government, the Minister of Public Health, and the Georgetown Public Hospital Corporation is procuring items from a supplier at cost that is 4 times and 8 times what is available from other suppliers if they had gone the way of pre-qualification and even public tender in an emergency manner. The public purse would have been saved billions or millions of dollars.
Public Health Minister Valda Lawrence explained that some 287 drugs had been in very short supply, and the potential for a crisis for several months had been looming by virtue of current suppliers defaulting on their contracts. She explained the process which led to her decision to order the drugs.
Called one morning indicating that there was a contract for Answer McCall in the sum of $600+ million. I asked that be pulled. I would like to see it. I want to know why Answer McCall is being given that amount. I called the CEO. I spoke with him. He indicated to me that this was the bid that they had sent out. This is what they had responded to. One of the things is that they were handling the cold chain aspect, and the fact that it was 2 weeks, they were flying these things in. Most of their drugs were also coming from Europe. And a result of that, that is how it ended up to be that amount of money.
Minister Lawrence also responded to allegations that she had breached procurement regulations despite the crisis situation.
That's the first thing. So the responsibility is that of the minister. Secondly, I'm hearing about the procurement process. The minister is not involved in the process. The minister is involved in declaring that there is an emergency and there is a need for us to implement whatever mechanisms are in place. And as I said, I was instructed, just like others, that you go to the short list, the companies that are shortlisted, and those are the companies that you invite to bid.
The next safeguard for procurement of drugs in the absence of the board after the shortlisting and bidding is further explained.
Process following whatever takes place at GPHC. The next safeguard is NPTAB, not the minister, NPTAB.
In addition to Answer McCall, New GPC and 2 other companies were also shortlisted and approved to supply drugs within the 2-week window. Previously, New GPC benefited from sole sourcing in the billions of dollars under the PPPC administration. For HGP Nightly News, Sean Embrack.